In this video, we want to introduce the concept of cultural humility. Best practices in healthcare are guided by healthcare providers' experiences, as well as research on healthcare. However, oftentimes the research on healthcare was based on people from majority groups, such as people who are white or able-bodied, heterosexual, or from higher socioeconomic classes. This means that the research on best practices in healthcare might not always apply to people who are seeking care.
You may be familiar with the term cultural competence.
This can involve becoming familiar with people from different cultural groups, their practices and values, in order to promote understanding and appreciation. While cultural competence can be a valuable practice, sometimes it is limited because it might lead to stereotyping people from different backgrounds, such as, all people from this group believe X, or all people from this group do Y. Cultural humility goes a step further. In a nutshell, cultural humility involves taking the attitude that each person is a unique individual and that a variety of factors in their cultural background may have intersected to shape who they are as a person, how they experience healthcare, and what their needs are in receiving care. We regard patients as the experts on their own lived experience and try to reduce the power dynamic to work in collaboration with them to help them in the most productive way possible. A core guiding principle related to cultural humility is that of intersectionality. That is, different facets of our identity can intersect in unique ways to shape our experience of the world and of healthcare in unique ways. Dr. Pamela Hayes in 1992 proposed the addressing model, which gives us a framework for thinking about how different aspects of identity intersect with one another. Addressing is an acronym that stands for the following aspects of identity: age, developmental disability, disability that is acquired, religion and spirituality, ethnicity and race, sexuality, socioeconomic status, indigeneity, national origin, and gender. Seeing people through an intersectional lens helps us to avoid stereotyping them and encourages an attitude of curiosity and humility in getting to know patients and what matters to them. Safety is a critical factor for anyone navigating healthcare with a history of trauma. One outflow of cultural humility is that it fosters an environment that can signal that safety. Where patients feel that they matter as individual human beings, this is an environment that is more likely to foster safety, trust, and collaboration. This means both patient and provider can work together as partners in care. It also restores a sense of choice, autonomy, control, and genuine working together, which is another aspect of trauma-informed care. So, what are some of the ways that we can foster cultural humility? Some examples include speaking with patients about what a safe environment means for them and developing a safety plan together that could be shared with other providers so that it does not have to be repeated over and over. This could be an opportunity to acknowledge the ways that our identity can lead us to be marginalized and stigmatized or othered in society. Are there aspects of a person's identity that bring them comfort and safety that they would like to be foregrounded? For example, prayers, smudge, or other cultural practices such as the medicine wheel might be of interest to some patients. For others, it might mean permission to bring extended family to appointments. For some people, it also means understanding their definition of family, which may not be biological relatives but their family of choice. For other people still, it could be clarifying the name and pronouns they wish to be addressed by. You could also have signage in your clinic that signals that people of all backgrounds are welcome here, regardless of identity. You could give examples from the addressing model we discussed previously. Having a conversation about safety that is based on humility can help to create a safe container together in the relationship. Having cultural humility means being committed to being a lifelong learner about others, understanding our own biases and assumptions, and having open curiosity about how others view and understand their own lives and experiences. For more information, we will link some articles in the description box of this video.